Good afternoon, everyone, and welcome to the Sphere India COVID-19 Academy. Just give me 1 second. Great, Glenda is here. Um, right. So, good afternoon, everyone, and welcome to the Sphere India COVID-19 Academy. This week, we are celebrating the World Environment Day through a series of 5 panel discussions on pertinent topics related to environment and COVID-19. Towards this, we welcome you to our first panel discussion, which is on climate resilient health sector, combating future health emergencies. This panel discussion will cover themes such as climate resilience of health sector, climate change and link between disease outbreaks, existing policies, plans on building climate resilience, and the measures at individual or community level to build resilience. It will explore how a resilient health sector can better respond to pandemic from prediction to treatment. For this panel discussion today with us, we have very eminent panelists from different institutions. We have, and I would like to welcome each one of them with a short introduction. We have with us Professor Dr. Anil K. Gupta from National Institute of Disaster Management. Dr. Anil is a sustainability risk management strategist working in the area of disaster management, environment, and climate resilience for more than 25 years with national, sub-national, and business administrations. He's currently full professor and head of India's NIDM, which is National Institute of Disaster Management Division of Environment and Disaster Risk Management. Next, I would like to welcome Dr. S. Satapathy. He's the former director climate change for Ministry of Environment, Forest and Climate Change. Currently, he's associated with the implementation of Green Climate Fund supported project on enhancing climate resilience of India's coastal communities in India, implemented by Ministry of Environment, Forest and Climate Change and UNDP India as senior technical advisor. Next, we have with us Dr. Rameshwar. He is an assistant director at Center for Environmental and Occupational Health, Climate Change and Health at National Center for Disease Control, Delhi, under the Ministry of Health and Family Welfare. He works for the National Program for Climate Change and Human Health and involves in the activities related to implementation of the program in the country. Next, we have with us Ms. Renuka Saroha from WHO India. She's the national consultant for WHO for Environment and Public Health and closely works with Ministry of Health in aligning global best practices with national strategies. With an experience of working for more than a decade on sustainable development with organizations in Singapore and India, her core areas of expertise are air quality management, vulnerability assessment, climate resilience, and adaptation planning. Welcome all of our panelists. The moderator for today's session is Ilya from Sphere India, and I would now like to hand over this to Ilya. I would also like to make this last announcement for all our participants, except our panelists, to keep their videos switched off so that Glenda's video can be highlighted. Thank you. Over to you, Ilya.
Thank you, Valerie, and good afternoon, all of you. So as Valerie shared that World Environment Day is on 5th June, and we actually celebrate it to encourage worldwide awareness and action to protect our environment. We are also in the midst of a public health emergency, COVID-19, and we are struggling with it. But that's not just the only thing that we'll be faced with. There are along with it a lots of risks posed due to the climate change, and we'll try to understand through today's panel discussion what are the risks that climate change poses and how it can have adverse impact on health sector. So to begin the panel discussion, I would first of all like to ask a question to Professor Anil Gupta. So what kind of risks does climate change and its impact pose on the health systems? If you could just explain about whether it's extreme weather events, or what is it, and how does it really pose an impact on the health systems that exist? Over to you, Professor Gupta.
Thank you, Ilya, and thanks to the organizer for inviting me for this a very important discussion because health is something, as I always say, that health is your real property with you. So that's most important thing. And as you rightly said, that we are witnessing a major health emergency. uh, as far as your question to me, as relating to climate change impact on health, so I would look at in three ways. That climate change impact on health, there are three ways. One is the direct impact on people's health. For example, people's exposure to various climatic parameters, for example, whether it is a heat, whether it is extreme cold. So these kind of things also contribute to people's exposure to ailing situations. Second thing is that climate change is also known to jeopardize our resources and infrastructure. So, for example, the buffer that protect people from the devastating effect of climate change. If I take the example that if there is a good vegetation buffer, people are relatively protected from the brunt of heat. But if because of climate change and other anthropogenic factor, the vegetation has been devastated, and then that would lead to hydrological changes also, the reduction in the moisture level in the environment and also in the soil. So certainly the impact of climate change on health is going to be aggravated. Third thing is that climate change is the known driver of extreme events that lead to disasters, particularly water related disasters and weather related disasters. For example, floods, drought, also landslides. Then also related with the forest fire is also related. Many times epidemics, the epidemics are the survival of various pathogens, are also related with the climatic regime. So because of increasing intensity and frequency of disasters, so their health consequences are also becoming more complex and more damaging. And the fourth dimension is the disruption in the ecosystems that is also being witnessed as a contributor to health risk. For example, now we are witnessing the zoonotic disease kind of things, and then contribution to the vector-borne disease and all. So this is a multi-dimensional approach, not only one direction, that we can see that how climate change is affecting our people's health. And we have also witnessed recently, over past 10 years or so, very evidently. So we have been witnessing past 30-40 years, but very evidently in past 10 years or so, the geographical spread of diseases have changed. Not only changed, in some cases it has become widespread also. For example, if we take chikungunya, so chikungunya was highly endemic for quite long time. Now chikungunya has widespread. Then this there is also incidences of pandemic converting to endemic, and there also the climatic factors are contributing to that which are the geographical pockets that is going to continue it or makes these diseases long lasting to stay with us. So these are also the dimensions, and the climatic factors also trigger some mutations, and that is also the possibility that the new strands of viruses and pathogens are around us, and the existing treatment facilities that they do not work. So with new resistance power, these vectors or pathogens are there. So these are 4-5 dimensions I would like to refer here that is going to aggravate the climate change related health implications.
Thank you very much, Professor Gupta. And you very well highlighted what kind of health risks can be posed due to climate change. And one of the things that you mentioned, that climate change is known driver of extreme events. And we know that it's not just for extreme events, but also in terms of vulnerabilities, it alters the vulnerabilities.
Yeah.
So I would now like to move to Dr. Satpathy, asking that, Dr. Satpathy, how do we look at vulnerabilities, and are there systems in place through which we can have some advanced alert or early warning for the humanitarian professionals and health professionals to be able to prepare for such, rapid onset events. So how do we look at the vulnerabilities, and are there any existing mechanisms for such alerts? Over to you, sir.
Thank you, madam. I'm grateful for giving me this opportunity to be here to share my thoughts out of long experience what I had in the ministry for 35 years. And when we are talking of climate change, what Professor Anil Gupta has already mentioned, I will just give some climate change pretext to it. The change happens. When change happens, it gives both an opportunity and there are some risk or some disadvantage. When climate is changing because of global warming, it affects one of the component or multiple component of the climate system. Climate systems are like that: hydrosphere, cryosphere, biosphere, atmosphere, and lithosphere. These are, and it is not only acting on one sphere, and it is a multiple impact. When it has impact, an individual or a system or a group of system, they loses their capability or or the degree of to which all these systems are susceptible and not able to cope up with the new situation is called the vulnerability, where the exposure, what Dr. Anil Gupta has also mentioned, individual or a system is exposed to certain thing, and the sense, depending on the sensitivity and adaptive capacity, the risk emerged. Here many things risks are classified depending on the individual or a system, and the projection what from climate change it has come. I'm just addressing that how it is altering the incidence and promoting the incidence or accelerating the incidence, because all the parameters, there is expected average temperature which is likely to be increased, and the increase of number of hot days, then rainfall pattern will be changed, and there is uncertainty in sea level rise, then extreme weather events what it has been already explained, then heat waves, then drought, then flooding, then storm and tropical cyclones. These are all the offset, but the result of this climate change impacting in the system. Mostly when we are talking of impacting on system and linking to health system, if hydrosphere is getting impacted, then what is happening? Lack of water, more sufficient or more water, both are dangerous for the living system, and more specifically to human system. The incidence of disease relating to waterborne are more. If water deficiency is there or water overflow or flooding is there, our food security will be there. Disease again is relating to food security and malnutrition. Then if the atmosphere is getting impacted and influenced, then the environmental factors, that pollution, non-climatic of course, these are all impacting. And there are most importantly the biosphere, the spores or the biological organism, because of the increasing heat, they are getting dispersed by several mechanisms, which is also causing damage to the to the human health through respiratory disease. These are all biopollutants. Similar way, once the group or system enters into the vulnerability or um, and significantly showing there is risk, there are three types of risk. What is the medical and physical risk, health risk, then the mental health risk, and the community health risk. And the overall scenario of the vulnerability, where once we are talking to health system, I'm just explaining here, health system is not only the human health, I will say. There are 3-4 components are there. It is impact on patients or human population, impact on the infrastructure, then impact on human resources engaged in health system, then the supply system, and or the supplies like medicine and all medical equipments and all this, then the policy is also being impacted. These are the adverse impact of climate change or extreme events on this health system. Then the risk associated temperature related risks are there. And now frequently there is heat wave, temperature risks are there. Then extreme events like cyclone, you see every year in particular area in Odisha or West Bengal or Andhra Pradesh. It is last year there was cyclone and this year again cyclone. And these are the things which generate or which creates risk and vulnerability. Then waterborne disease, as I mentioned, insufficient water causes risk. Sufficient water or flooding system is risk. There is risk. Then the overall scenario, once these things are happening, the population migration in the current situation, you can see the this coronavirus. In the first lockdown period, there was no movement. Once the movement started, the migration started, there are a lot of disturbance in the system, which includes the health of the population, those who are migrating. And as Professor Gupta mentioned also, the vector-borne disease, the unforeseen. When we are talking here, I will just explain. When we are talking of any biological organism, it is in the ecosystem. And the nature maintains its balance, which is known as the homeostasis. The influence of human being when made this system imbalance, there are emergence of some biotic component in the system, which are the characteristics of the biological organism which is emerging are not known, and what will be the implications are not known. What are all the antibodies or preventive measures not known. This is the present scenario where we are. Here again, I am emphasizing not directly climate change is attributing to it, but change definitely is attributing. And here some climatic factors like temperature or consumption patterns definitely are influencing. The second part of the question is, are there systems in place to guide advance alerts to public health and humanitarian professionals? That is a rapid onset emergency. Yes, there are presently we had like our India Meteorological Department. They are forecasting cyclone, weather conditions, and now they have started also heat wave. Recently, they have declared that northern states are under heat waves. Then always Orissa and northern part of Andhra Pradesh, they are influenced, they are impacted by heat wave and all this. And ICMR is an organization which is because of their research, they are able to forecast something and to alert the human population. As such, my observation that there is no such mechanism to alert the public health system. Definitely after the event happens, like this pandemic, we know that COVID virus is there or something will come, then we are preparing ourselves. But there was no such system to alert the community, alert the system, or alert the governance system at national or state or regional level. It is lacking here, but IMD is playing its critical role, forecasting the exact nature of cyclone or heat waves or rain patterns. That helps us a lot to prevent some incidents of new risks due to this climatic variabilities like rain pattern or temperature or certain things. That's why we should not say that things are not there, but things are here. But now we have to see in the conjunction with climate change, health, economics, and the population livelihoods. Your livelihood. Combining all these four factors, now we have to develop certain system or early or warning system, which will give sufficient signal to the public health department and the humanitarian professionals who can take adequate or appropriate action before the things happen.
Thank you, Dr. Satpathy. So I really liked your emphasis on the need for having a system which could really give early warnings, while there are such systems which are forecasting, and especially IMD has also included forecast for heat wave, which is great. I like the way you began by saying that whenever a change happens, it also brings opportunities. So I think when we are faced with the impact of climate change on health systems, there's also an opportunity for us to develop resilient health systems. So, in terms of a health system that will be able to combat future health emergencies, what are the various aspects? If I could request Ms. Renuka Saroha to please shed some light in terms of what are the various aspects of building a climate resilient health system which will be able to combat future emergencies.
Okay. Thank you, Ilya, and thank you, Professor Anil and Satpati, for giving so much inputs, and thanks for everyone joining in. So, when we talk about a climate resilient health system, there are many aspects, right? From creating infrastructure to informing our public that things are going to happen, and this is how we can prepare ourselves. So a healthy public is a resilient public. So we have to work on various aspects to create healthy climate resilient systems. Few of the areas that we need to look upon is leadership and governance. We need to have a strong leadership at all levels, starting from the district and the primary healthcare level to the top level, where people are thinking how we can integrate the climate change and its impact at different level. At the health systems, while we are making our national infrastructure, when we are making any schemes and any policies, climate change has to be at the center, and then we decide what is the future going to be. We start talking about what our life is going to be 5 years, 10 years, and how climate is going to play an important part in this. Then what comes next is the key and the pillar of our health system is the health workforce. So we need to start preparing our frontline warriors. We need to start preparing our doctors, our nurses, and people who are providing these health services. We need to start build their capacity about climate change. They need to understand the pattern would shift. They need to understand what it is going to be, because people are going to come to them, and the public is not going to have that much of information as much as a professional would have. Plus, we need to tell them, as Dr. Satpati said and Dr. Anil Gupta also said, the patterns are changing. So, our doctors in remote areas in our hilly region need to know that the cases of malaria are going to come in those places as well. People would have not seen, the doctors are not prepared to handle malaria cases or chikungunya cases, but that is going to happen. There has been incidences where a lot of parasitic diseases have been reported in Madhya Pradesh, but doctors were not aware of these kind of diseases because it has never been recording in that climatic zone, but now it is changing. So we need to prepare our workforce also. And then India is constantly moving towards improving its health information system. So, and digitizing our health information system is the key. As we saw in the COVID case, we have system in place where we could detect the cases, we could count the numbers, we could point it out where the cases are coming from, then take the remedial actions in those cases, inform people about that, Arogya Setu app, through Arogya Setu app, or through the COVID trackers that have been developed. So we need to make these kind of system for many other diseases so that people know where the hotspots are coming from. The governing system can take cognizance of that and can improve. And it is as simple as that our medical records also need to be digitized now. So imagine you are living in Assam where every year there are floods. You lose your immunization card. So how do we know 10 years down the line that this child has been immunized for chicken pox or not? So if there's a system where all our medical records are accessible and are on digital platforms, so that in future if any emergency is needed, we can check their history, we can check what kind of treatment is to be given to them, and a burden on the doctors and the patient is reduced. Apart from that, there is an increasing need to focus on the research on climate change and interlinkage between health. So we know that parameters are going to change, but we also need to understand how it is going to impact the health system as such. How do we develop? What is the research which is going on to reduce this impact? What is the research which is going on to make that our supply chain, services, like we need to have our medicines in place. We need to have the entire supply chain. We need to start thinking about, okay, do we need to change the nutrition patterns in communities? what kind of research is going on on those aspects. So that is also something that we need to now start talking about and start investing in. And apart from that, uh, the key is that we need to start investing in our communities, so our communities need to know how to prepare in case of a disaster. Our communities need to know how to react in case of an health emergency. As we see in the current COVID situation, a lot of emphasis has been gone just to train our people that, wash your hands, cover your face, follow these practices when you are going out, stay alert and stay safe. So we need to start developing this and inculcating healthy practices in our children, in ourselves, in our elderly population, so that in future when we see the risks are increasing, but we are prepared to handle them. As simple as washing hands, getting the right kind of immunization, taking care of your health. So these kind of messages are also very important that we start telling our people. And the focus, COVID has brought the focus back on public health and as an individual. So we need to just continue with this momentum. And climate resilient healthcare would mean that, when systems are going down, the last building, which is a hospital, is still standing. We still have our doctors who are able to come to those buildings and provide their services. Our doctors are safe. Our frontline workers are safe. So that is also a very important part of a climate resilient health systems, that our buildings are standing, our doctors are safe, and they get the right amount of equipment that they need to perform certain services, and they're able to communicate not just with their patient but with the outside world. So the subject is very big, and there are many things which will go in creating a climate resilience system, but we can start with small blocks and then build it further. Thank you.
Thank you, Renuka. Um, So as you mentioned that not just doctors, like there are emerging diseases, there are new things which people are not prepared for, and therefore there is need for a better information system, for better preparedness of doctors, even in terms of medical records or vaccination records. If they are lost, then the whole system is lost, and how the health facilities and hospitals also, the preparedness of hospitals is also very critical. Now, today we also have with us Dr. Rameshwar from NCDC, who has great experience and understanding of hospitals. He was also recently in Italy for the COVID response and evacuation. So, Dr. Rameshwar, if I can ask you that in terms of preparing hospitals, what are some of the measures that can be taken to build green or climate smart hospitals? How can we do that, Dr. Rameshwar?
Thank you very much. It's a great pleasure. This area is our soul and vision of our this national program. That is a national program for climate change and human health. We we think and we work only for this this program. We are the technical nodal agency across the country for this health mission part of the climate change. And I would love to speak on this green and climate resilient healthcare facilities. This is my area of work particularly. See, actually, when we say about climate change, the solutions are two. One is the mitigation, another is the adaptation. This mitigation part is dealt by the green part, this green healthcare facilities. This concept itself, this green concept itself is going to, this bring the solution for the mitigations of this climate change. How? How green is going to help in that? So green is about to this decarbonize the health sector. This how is going to be how it is important. The health sector, as you all are aware that it is a highly intensive 24 hours running across the day, and this when the whole year it works 24 into 7. So that it is highly consuming these energies, and at the same time it is producing a lot of this what to say these carbon emissions, and it produces up to the level of about 10% across the world from many countries. And in India it's about this 5% of the carbon emissions from the in different sectors, and it is next to this power and this transport, and this health sector as such is giving a lot of this part. So if we work now, what to say, in this concept, this green concept is about, saying that we are going to use our energy in a very efficient way, and water has to be consumed in a, in a very conservative and in this very sustainable, efficient manner. And we need to conserve our natural resources at the same time. So even the waste production and all this generation should also be lesser. And ultimately, our human and this ecosystem life will be in a very healthy and comfortable way. This is how the grid is going to, impact me. So there are some components about the green is that. See, in the energy efficiency, as I said, there are some components are there. Energy efficiency is one of the components. In that we are trying to use the, this all these energies in a better way, like using of this LED. LED has been this uh, given more significance, and it has been replacing most of the this bulbs and all. So this is one small example. Another thing is that this renewable energy in the form of this solar energy or wind energy and other distant LPGs and all. No? These are considered as renewable energy or cleaner energy also, and this does not produce this carbon emissions and all. So these renewable energies, these are very much important in this in this present scenario, and in the this coming this years, because climate change is the biggest threat, and is in another 10, 20 years, this climate change is obviously going to impact. And right now it's it is a very what is an important juncture to use all this renewable energy. At the same time, another component of this green part is the transportation. And why transportation is that? As you all are aware that transportation is using all this these fossil fuels, and we are trying to use the cleaner fuels. And this at the same time we are trying to reuse these fossil fuels. These fuels, fossil fuels, as you all are aware, that it produces more of these carbon emissions. At the same time, it creates this global warming and the climate change. And ultimately, these are things. And the other components that we can discuss, these are about this water conservations. In here, we consider some main components like this rainwater harvesting in areas where the raining is there, but the it does not rain the whole year, so they need this harvesting what to say, these mechanisms, so that they don't fall on other or depend on other sources for use in the this in water consumptions. And this is very much a component of the green healthcare facility, and using of sensors in this water faucets. This water faucets is very important because now, well, the traditional water faucets, they there is a lot of consumptions now, so as the outlet is quite bigger. So we need sensors. We need this appropriate this what's a faucet size and all, so that the use of water is conserved. And we can also develop this use of this gray water in the sense that the water is recycled from what is used in domestic, or at the same time from the hospital also, and this can be used for you know uh, for plantations or for other purposes. And apart from this, there's one very important concept about this green healthcare facilities is a sustainable green procurement. Sustainable green procurement, it says that whatever we procure, whatever we are utilizing in the hospital setups, because hospital uses a lot of this what is items, the beginning from the this or this what to say, this important items like MRI, CT scan, and all these medical implants and all. We these all these things. If what does this green sustainable green procurement says is that if it is produces in a very sustainable way, in the sense that the localized way, if the transportation is not and if it is using the locally used product and all, so that during the time of this transportation also there is quite consumptions, huge consumptions of this these fossil fuels, and there's emissions of a lot of these carbons. So these are some of the considerations in case of this green healthcare concepts. Apart from that, there is one more concept, is the climate resilient. Climate resilient, it says about adaptations. This is the main area which we are working upon. Is our health sector works more on the this adaptation part. This the national programs that this deals more on the adaptation part. The this mitigation is more from the environmental sector. So in this climate resilient, this concepts on these healthcare facilities, we have considered them on the basis of that, because during the time of this these extreme weather events, as you see, as was discussed before also by Anil sir, at the same time or by our Satapati sir and all also, that one of the direct impact of this climate change on the health is the this is the extreme. It is due to the extreme weather events. And extreme weather events, these are the cyclones or the this heavy rainfall, floods, this severe this what to say, heat waves and all. And these all these extreme weather events, as you know, with climate change, is going to be increased not only in the frequency, and it is also increasing in the magnitude also. So what do you mean by this frequency? At the same time, magnitude, it says that, see, in India recently, even in Kerala also, Kerala is living examples. These are live examples. We have already seen and aware that the successive to these floods and these heavy rainfalls has occurred in the state of Kerala. And at the same time, there has been a lot of cyclonic impacts in the country. As you see, recently Amphan these cyclones, and last year also. And recently also, we have been having this severe the heat waves. We have already suffered, recently only for about 5 to 7 days. So these extreme weather events, is going to impact the human population. At the same time, it will impact our healthcare facility, healthcare facilities. If it is not climate resilient, then that our so much that important is healthcare facilities during the time of this crisis will either collapse, or it will not be able to function. The healthcare the professionals or workers who have been working in the healthcare facilities, they will get, either they will be getting injured, or they will be dead. They will die during the time of this is this extreme events like cyclones, or they will not be able to function properly. So, we need to think really, on this aspect. This climate resilient, consideration is put up in this healthcare also, for bringing a total for developing a climate resilient health sector. So while, considering this climate resilient concept, we should be aware that, we have to think very much on the climate, this multi-hazard assessment of the facility while developing. And we have to think about what are the climatic risks in that area, and what are community vulnerabilities in the area. We need also to think the clinical care facilities, the vital clinical care facilities or functions, like this emergency functions, like this ICU functions, where if the treatment of this patients, if it is deteriorated, or interrupted, there can be impact on the life of the people. So we need to protect these functional areas. We also need to understand about the infrastructures, these protections and the resilience. This as we see these extreme weather events, these are quite this forceful, this impacts natural forces. So in order to at least withstand some part of the these vital functions, if we can withstand the whole this functions and the structure, that's well and good. But even if we can do some withstand some of the vital clinical care facilities, I mean, that will be well and good. So these are the considerations that we need to put up in the climate resilient health sector also. So in order to work on these areas, we have been working with one of the this IPSS guideline. And this IPSS guideline, it develops some standards across the country. And this they are about they are to strengthen the healthcare institutions, like this sub-center, primary health centers. As you know that primary health centers are launched in the country. This is about 1.5, more than 1.5 institutions. And there are community health centers, there are district health centers, there are sub-district health centers. See how much so many there's institutions in the health sector, health institutions in the country. If we can put both these concepts of this green and climate resilience in all these sectors, then how our this sector, our whole health sector become this climate resilient. These are the thoughts that we are put up, and we are trying to come what I say in this area, trying to develop in this area across the country, one after another, and we will be in the next few years we are developing that part, and we're trying to develop a climate resilient health sector in the country. Thank you very much.
Thank you very much, Dr. Rameshwar. You highlighted some of the very important points, like how it's important to look at various aspects to build a climate resilient health sector. We have to look at renewable energy, we have to look at uh, not just the health part of it, but transportation parts. There are lots of linkages between various sectors which need to be considered if we really want to have a resilient health system. So I would now like to move to Professor Gupta once again. You have worked in the government for so long, and we all know that the coordination and synergies between various ministries and government departments, and also NGOs and CBOs, is so crucial. So, Professor Gupta, if you can share what are the existing mechanisms of such coordination between various ministries, and how can those be strengthened further, knowing that this is such an important area and there are interlinkages? Professor Gupta.
Thank you, Ilya, for raising this important issue. Before I speak on this issue, I would like to highlight and as I hope that all will agree that it really took some more than expected time, especially in our region, South Asia region, and also in our country, uh, for for bringing the desired focus on environmental and public health issue, because for quite a long time the focus was on clinical approach or curative approach to treat the symptoms or treat the patient. So more than 5 6 decades, in fact. Yes, that was important and that was needed also, but now there is a major shift, and major shift is coming towards the concept of holistic health. So even if we talk of the kind of desired level of investments or desired level of planning and coordination, this concept itself is very important, that how we are going to understand holistic health. And uh, for for enabling I would say an ecosystem or enabling a system of holistic health, we require some kind of a mapping. Map, Mapping is required basically to have an understanding that in order to have in order to enable holistic health of our people, which are the major components. For example, if I directly come to the health ministry or health department level components, then it is the health system or the health facility. So that is the core unit for health. But that is not the entire thing about the holistic health or the public health. Then what is happening within the community, or what is happening about the social behavior or the environmental aspects within the community, the exposure of people with their environment, the quality of environment, the quantity of the environmental services or the ecosystem services. So that dimension is important. Then within the health system itself, what are the subset facility? For example, the doctors are there, as the previous speakers referred to, that you need to have a proper inventory of the medicines and the correct medicine required. For example, if you know that this is the period of malaria outbreak, so you need to have those kind of things in advance, or whether that area is affected by any other kind of diseases. So looking to the disease pattern, looking at the projected scenario, inventory. But it is not only the doctors and inventory that can help reduce the health complications, or can treat the patient immediately or shortly. There are many subset facilities within the health system premises. For example, within hospital, you need to have backup electricity. You need to have backup water supply. Even if your electricity fails, how can you operate your operation theaters? How can you have alternative, for example, alternatives? You can think of even green approach also. Partly you can convert the hospital to the green energy, and partly you can have the backup diesel generator or whatever generators are the battery backup. So these kind of facilities and waste management systems. So I'm just referring to 2-3 subset facilities, but there are a number of subset facilities on which the continuity of the functioning of the health system will depend. So this is dimension 2. Again, coming to a more important dimension, even if the health system or health facility along with the subset facility is intact, but if the road is washed, the patient cannot come to hospital, or otherwise your mobile vans or the doctors cannot reach to the community. So outside the health facility also, there is a coordination between our interdependence with other sectors that is also important for for keeping your health system functional. Otherwise, you have best doctors with you, you have best facilities with you, you will not be able to provide your services. So continuity of services will depend on various other sectors also. So these are 3 dimensions. Now coming to the 4th important dimension, our honorable prime minister and the current government, we have a major ambitious program that we call it Swachh Bharat Abhiyan. This is one. Now there are other missions related with water, related with the waste, related with energy, as the previous speakers refers partly to that. So those missions also going to contribute greatly to the health resilience building. When we talk of holistic health, and there industrial health and occupational health has been a poorly addressed issue, not only in India but many countries of the Asia Pacific also. Bangladesh is also an example. We have few participants here from Bangladesh also. So and even in China, what are the occupational safety and health issues? Officially and unofficially, we know a little that these issues are important. So the investment also has to be has to be seen that direct investment or direct enhancing the resilience of the health system, plus managing the effective coordination with other sectors on which the service will depend. Then how we are going to change the health behavior of the society. For example, now we are asking our people in the COVID that you use mask, you use a better level of hygiene and sanitation. That requires a social behavioral change. In fact, people have to bring that in practice. That is important. Otherwise, despite of knowledge, sometimes we focus on awareness, but many of the people, you might have seen that the people know that cigarette smoking is injurious, but they know you have stickers on the cigarette packets that it is injurious to health. They smoke. Similar is other tobacco products. So we need to understand that we need behavioral change, not only a kind of literary awareness. So that is also important for enabling the health resilience. So health system resilience and investment also directly going to the Ministry of Health or Department of Health is one component, but the investment going into other departments or other activities, even investment going into NGOs or expenditure or the investment, the work done by NGOs, that cost is also supporting your health resilience. Even the schools, if schools are teaching your children better hygienic practices, then even the school education budget is also contributing towards health. Similarly, within industry, if industrial safety, industrial hygiene can be improved, so that will also be an additional contribution. So looking to this, NCDC is the nodal agency, as we have the representative from NCDC. Recently, under this new national mission on climate change, that is on health, we have come up with National Health Action Plan, and primarily it is adaptation plan, but certainly there are components of greenhouse emission reduction and converting the infrastructure and other things to carbon neutrality also. So we have also contributed to a very important dimension, that is the health resilience plan for climatic disaster related illnesses. So that plan directly pertains to the discussion that we have today. And there we are seeing that the financial allocations or the financial requirements both way, coming and going both. Several institutions are to be involved, and then only, for example, in states, we are thinking of some pilot programs. So certainly the disaster management authority will come into picture, health department will come into picture. When we are talking about the health complications projects, health complications projection, that we have been talking about the weather data products, not only the weather information but the data product. And we have been able to do something significant in the area of agriculture, that we have agro advisory. Now I'm talking nowadays that can we have some system of health advisory, and probably health advisory will contribute largely to the preventive health. That is actually the real purpose of the health action plan, not only the curative approach, but how we are able to prevent. And then certainly the prevention is not always possible, so how best we are prepared to tackle the things, not from only from health department side but the community side also. So these are the things we have to look at. And then certainly the lowest units like sub centers and the taluka and district, these are going to be real things. And before I close, my submission here, I would like to refer to some specific examples that how health system faces diverse risks also. Like in Orissa, in cyclone Fani, we experienced that for a better care of the pregnant women, we took the pregnant women and put them into the hospital, a major hospital. A large number of pregnant women were there, whose the dates of delivery were close by, so in order to protect them. But what happened, the cyclonic storms, the water tank was intact but the connecting pipes were blown away, so there was no water supply. But on the other hand, entire water was within the hospital. And similar situation was about the electric connectivity also. So health system also requires resilient connecting a resilient subset infrastructure as well. So that is very important. Without that, we cannot think of health system resilience. So these are certain points I wanted to place for your consideration, please. Thank you. Thank you, Ilya.
Thank you very much, Professor Gupta. And one of the things that you mentioned about for continuity of health functions, you mentioned that we need to not just look at the hospital and the functions inside the hospital, but also outside hospital. If the road is blocked or broken, how do people reach the hospital, or what's happening outside also needs to be looked at. So there also we understand when such incidents increase, there's also an increased demand of health workforce. I was just wondering that are there any ways for technical and professional capacity building of health workforce and decision makers in terms of using the climate information for health decision making? Any thoughts you had on that before we move to the next?
Yeah, actually, a very important point. Actually, I thought of touching it. I missed. Thank you for reminding. When I was discussing about this weather data products, basically how we use the simple climatic projection. So one is that the specialists, they do modeling and they provide you the projection and this thing. But it is also important that we enhance the capacity of the health managers. I am not talking of the doctors, but the people who are responsible in the capacity of superintendents or who are associated with health system management. For example, we also have a system of IDSP. So we are also talking, we are discussing to evolve an approach where using the simple statistical tool. For example, the Microsoft Excel, everyone has Excel on the computer. Can we use simple statistical projection to understand that what are likely critical scenarios? So at least we understand the critical scenarios. At least we can divide whether we are going to likely to enter into a critical scenario or not, at least. And then beside this, we are also talking that in the districts, we have the approach of IDSP, integrated disease surveillance program. On the other hand, we have the India Disaster Resource Network, IDRN, and there is a district statistical approach. So, but what is happening at present, that all are working very nicely, but all are working separately. So there is also a call for integration, because if we look at the coverage of data, maybe 60 or 70% information is same, but if that can be integrated, that will have a benefit in really understanding at local level, because national forecast or sub-national forecast at state level is important, but most important is the local forecast at district level and sub-district level. So that we are thinking, and we have also started. We are currently working on a training module also, and maybe within this month only, we are expecting that that training toolkit, that is a complete training toolkit. In fact, thanks to Renuka, WHO has also been a key collaborator for that, and NCDC also. So we are coming up with that training toolkit, and that will be available here. And there we are, we will be flagging off the capacity building programs on particularly addressing this issue as well, and also the issues related with resilient infrastructure to support the health facilities. So we will be certainly looking at a lot of collaborations and cooperation from various other institutions also, NGOs also, because India being a large country, certainly a number of institutions are required and we have to work together. Thank you.
Thank you very much, Professor Gupta. Thank you. So taking a cue from what you said about...
Hello, ma'am. Can I come in this area? Actually, this is one of our main objective for national program. This national program for climate change and human health. As you said about the, this capacity development of the, this healthcare workforce. This is, is a very important, this objective of our national program for climate change. That. See, so we are, trying to, develop these modules in relations to the this medical officers, in relations to the this let's say nursing staffs, in relations to the all other this incoming. We are trying to put this medical curriculum also to the this medical graduates and postgraduate and all. So this, as you said about this capacity development of the healthcare workforce, this is very much an important aim and objective of our national program also. Thank you very much.
Thank you so much. That's very good to know that we also have the capacity building as a part of your plan. Another thing that Professor Gupta touched upon was the need for investment in health action plan and health systems. So I would like to move to Dr. Satpathy. And Dr. Satpathy, based on your experience and understanding of the sector, if we look at the investments in health system in India, do you think it's adequate for a resilient health system?
Here we are talking of investment. What
Dr. Satpathy, you may have to speak a bit louder.
Dr. Satpathy may unmute his mic.
Thank you, madam. Just I will continue what has been said by Dr. Gupta regarding investment, but here I will try to just analyze. We are talking of investment, but what we have at present in any governance system, that there is a budget system, then expenditure estimation, then expenditure utilization, all these things we are talking. When investment is coming in commercial mind of for commercial people, they will think I have invested means this much will be returned back. If we are talking of in that sense, that also I will include my deliberation. First thing I will say, who are all contributing as budget allocation or committed expenditure or investment. There are various organizations like Ministry of Health is contributing. They are not investing. It is a budget for expenditure. Then other Ayush Ministry is also proposing having some budget for expenditure, not getting any benefit out of it. Similarly, other government agencies indirectly are contributing to health system. What Dr. Gupta also mentioned, like agriculture sector, road sector, communication sector, power sector, they are all contributing indirectly to enhance the capability. I'm not using word right now, resilience, enhance the capability of health system to handle the situation. Similarly, we have one good system, that insurance, which is also supplementing or directly providing support to people for health ground again. Then private people. In India, during my childhood, I had never seen such a nursing home or private hospital. Now private hospitals are there. When we go to the private hospital, there we realize there is some investment. If I go to government hospital, there I feel that some budget is there, some expenditure is there, some deficiency is there, some more requirements are there. I'm just coming to the investment, why we will take it as an investment. Investment, when we are talking from the ministry perspective or from any agencies like multilateral agency or World Bank supported or many then certain charity funds and companies are providing under their CSR, corporate social responsibility towards health. If we, when we are talking of health is wealth, if we are okay health wise, if we are perfect, we are earning. A capability of an individual to earn depends on his health. That's why whatever we are investing, we are proposing as budget through different government agencies or private agencies or insurance to enhance the health status of an individual or human system, which in turn gives money or gives benefit to the community, to the state, to the nation, and to the global system. Here, what we need, whatever investment at present we have, if now I'm coming, considering all these budget allocation or expenditure proposal are one sort of investment to get back something as benefit or in economic term, we need whatever we have at present in India, it is to meet the present requirement. And we act always after seeing some event, we adjust or put some additional money. When we are talking of resilient of a system, it is either a self-resilient to all aspects or resilient to climate change. What Professor Ramesun also had mentioned, on several occasions, I had an opportunity to discuss with him and Dr. Gupta regarding the climate resilience. In my last intervention I had made, when the impact of any system, impact of environment or impact of climate or impact of insect, what we have seen few days back, or impact of some some aggression or something is there, then we have to see what are the additional amount we need. At present, what we have, my conclusion, it is not sufficient to announce or to declare us as resilient to anything, not only the climate system. But through our national mission on climate change and human health, yes, certain proposals or certain schemes have been proposed to enhance the adaptive capacity and managed mitigative capacity to enhance the resilience to reduce the climate change vulnerability. Means we will say that the system, either it is a hospital or it is a health system of a state or the national system, that could be resilient. And for that, we need additional money. That additional money, either we have to offset the existing budget or we have to have new allocation or new investment. In order to achieve that, to get the new additional money, we have to identify the gap in each area. In each, when we are talking of climate resilience, there are certain principles or certain components where we can make some additional activity to make it resilient. That additional activity needs some money. Any activity, if you are doing something, it has some costs. That additional cost need to be identified, to be estimated. Then we have to see whether it can be offset, adjusted, or additional money need to be mobilized. Then we have to see that how, to what extent we have the adaptive capacity. One example I am giving you, under this present scenario, last 70 days, definitely personally I would like to admire our system, which has increased a lot of tremendous adaptive capacity to face the challenge. Means towards the resilience, we are enhancing all our activities to make the health system in India is resilient, resilient to new incidents, resilient to any threat or any new shock. But however, whatever we are counting now, death rate, incidence of disease, active disease, all these things are one part. But when we are talking of investment, whether it is sufficient or insufficient, it depends on the need, what we need. Because the need varies from country to country. In India, we are managing in such a manner to reduce the mortality or to manage the event. At the same time, developed country having money, they are not able to manage. Means the autonomous adaptive capacity is there in our country. Our people, they know how to manage a situation without, suppose there is no electricity, how you can manage. If you go to the Sustainable Life or Parampara, there was a book published by the ministry where it was highlighted in the absence of electricity, how you will preserve your fruits. People, they were using in village in earthen pots. They put a what is that bori or that jute bag and put some water. They maintain the temperature and they get the fresh vegetable. Similarly, in Odisha, if you see how to preserve food, there is no electricity, there is no other preservative. Simply they add water to the rice, and that is again their very good food, and which has significant resistance capacity. Similarly, we have to assess what capability we have, what capability we need. These capability are in different stages. Additional requirement for hospital infrastructure development, additional requirement for manpower enhancement, additional requirement for enhancement of supplies like whatever medicine or equipment or what we have identified. Then additional capacity, then additional awareness, then additional cooperation, then additional understanding of the issue. For all these things additional, we need some expenditure. Currently, whatever we have, it is to manage the current situation. Of course, with some vision of future, like if malaria happens, what will happen? If dengue happens, what will happen? For TB, for some diseases, we have some forecast or some provisions. But like climate incidents or the incidents happened like this, COVID or the Corona, we don't have. But if you go through all hospitals in India, even including private, none of the hospitals they have taken care of at present the resilient component. But Ministry of Health and Dr. Rameswar has mentioned that they are preparing very good guideline. Definitely, our existing as well as new health facilities, existing they will retrofit or new facilities will definitely incorporate. But my submission here, while constructing the building, the authority who gives permission to have that building, including if it is a large infrastructure, then Ministry of Environment or state government, they are giving clearance. Now they should insist, if not mandatory, voluntarily, you have to include all these things, climatic parameters as envisaged in the guideline. Then only you will have permission to establish that hospital. If that things comes, there is no need additional funding for infrastructure development in case of new. Yes, in case of existing, I visited some hospital. There was the problem that simply they are telling for maintenance of pipes, water pipes, or electricity wiring, they don't have money, and they are asking when we don't have existing money to maintain our existing facilities. You are talking of climate resilient and adaptation. From where we will get money? Yes, we have to have an assessment at national level. What Dr. Rameswaran is in the process of doing probably, and in our health mission, definitely these things have been envisaged. And all state governments now they are preparing their state action plan version 2, and it has been advised by all by Ministry of Environment, Forest and Climate Change that they have to take care of health and disaster management, considering the national issues as well as local issues, and they are incorporating that. But when we are talking of investment, we have to see. And if you see any private agency, if they are investing, first they will see what is the benefit of how we are getting. But they don't consider the socio-economic benefit of a healthy society or healthy community or a healthy state or a healthy nation. Definitely, a healthy nation will will generate or will earn more money than an unhealthy society having more money in the bank. That's my concern here. That yes, the budget provided is not fully adequate to address the resilience, particularly. Yes, to meet the need to some extent is available. But for additionality, what we intend, our survey report or assessment will say what is the gap or what is the additional need. Once additional need or needs are identified, then government need to see how to adjust, because if government asks additional money, additional budget to the central government or to the Ministry of Finance, they may say you have to adjust within your allocated amount. But we have to see how other ministries are helping us as the coordination part in the previous discussion. When we are talking of coordination part, then we have to see how other line ministries or other stakeholders are reacting to that, like Swachh Bharat mission or the drinking water mission. If they are providing good drinking water, we are safe. At least disease due to contaminated water will could be prevented. If
Thank
air
you.
pollution is addressed by some other stakeholders, yes, pollution, health problem due to air pollutant is being addressed. Similarly, what it was mentioned by Dr. Gupta, that power and other ministry, they are contributing, but one thing is not there, that coordination. Health ministry never bothered what power ministry, when they are stretching their line and distribution line, they never consider that health aspect or the resiliency or the cyclone or disaster aspects. Now they have seen Odisha last time, funny, I was there. Thereafter, what they did in the electric pole, they have reduced the height. And instead of having a powerhouse, that generator at higher place, now they are placing it on ground so that high wind or wind velocity will not disturb. These things are to be considered in a coordinated manner. If all the stakeholder departments, health ministry, state health department, under the guidance of National Health Mission and National Mission on Human Health and Climate Change, they can have an attempt in the consultation with, of course, disaster, because it is the most important. Uh, we can prepare something, prepare a framework where how much the reduced investment is
Yes.
required to get the adequate or the desired benefit.
Right, right. Thank you so much,
Well,
Dr.
concluding, just I'm
Satpathy.
telling that
Yeah,
investment, how you spend, again, the enforcement is another important. Suppose government has allocated 1 crore, how it is enforced, how effectively the outputs have been generated. These things are, many things are there. That's why we can't say that investment is fully
right.
inadequate, but at the same time, we can say it is visible that investment at present from all sources are not able to meet the desired need to make the system resilient. Thank you.
Thank you. Thank you very much, Dr. Satpathy. Not just talking about investment, but also the importance of coordination. I'm also seeing the chat box, and it's very engaging. It's good to see that all the participants have so many queries, and our panelists also have been responding. Professor Gupta, Renuka, they've been responding. So one of the questions that we've received so many times in the previous sessions of COVID Academy, and I think this is a very appropriate session to bring it up, is that during COVID-19 there is a lot of emphasis on hand wash, like every few minutes, frequent hand wash. So everyone is doing that, and which is in turn affecting the or resulting in the depletion of water resource. So um, if it results in severe water shortage, what will we do? What needs to be done in that? Is there a need to integrate health in water resource management? What do you think, Ms. Renuka, if I can ask you about that? Ms. Renuka?
So, like this is a part of climate resilience that we are talking about. And if we go back to the pre-COVID numbers, globally only 60% of population had access to hand washing facility at their household level. So, it is not just that hand washing is leading to water crisis, it is that not having access to water is also leading to health implications. So it's a cycle that we have to break and we have to think about. So just to say that because of washing hands it will lead to water crisis is not the right statement. But what we need to definitely have to look, like as Dr. Rameshwar also mentioned, what is the impact of our healthcare on our environment? What is the impact of our healthcare systems on carbon emission? So this has to be taken into consideration. And again, how do we reduce the consumption of water is the key question here. So, and as you would have seen, as the hand hygiene campaigns evolved, it was the people who came forward and started talking about, okay, close the tap while you are washing hands. And do not waste water while washing hands. People are collecting that water or they are reusing for other purposes. And this is a response which has come collectively from people, and it is happy to see that people are now talking about conserving environment, and they have realized, our health cannot be eliminated from the environment that we live in. So both of all these things go hand in hand, and it's a close group that we have to work in. And this is where the climate resilience part and the investment in climate infrastructure and climate system comes in. If we have had invested in making health hand wash accessible to everyone, if you would have invested much earlier in making a behavior change of washing hands, maybe the disease would not have spread so much. And if we are investing in our nutrition, if we are investing in maintaining a healthy lifestyle, a healthy work life balance for all our people, we are creating a resilient, and you would not have to ask this question again, like, okay, if we start washing our hands, would we be reducing our water resources? The again, as Dr. Anil also said earlier, it's the prevention that we have to start talk about. We have to work on not having these kind of pandemics and disaster earlier, you know so this is what my response would be when we say about, is hand washing leading to water crisis? No, it is not. We anyways have to be very, very careful about the resources we consume. The problem was much before the COVID crisis and hand washing campaigns. And we are going to save a lot of lives when we focus on hand hygiene, be it through washing your hands, be it through sanitizing your hands. That is the focus that we have to go ahead with, and conserve water in other places wherever we can.
Thank you very much. So instead of focusing or being concerned about how the water is getting wasted, I think we have to focus more about preventing such incidents happening where we need so much water. So very well. I think most of the people, listeners, and participants who have had this query for a long time would be a bit more clear. I would now move to closing remarks from all, so that then we can move to question and answers. I can already see raised hands. We'll come to
Ma'am,
the participants
excuse
for
me,
question and answer
ma'am.
round.
Excuse me, ma'am, can I come in for 1 minute?
Uh,
I just want to clear about the Dr. Satapathi's, this statements on, the concerns on the financing part, right?
okay.
Hello. See, actually, this national program on climate change and human health has the opportunity of, these introductions in these national health missions for PIP in the last year only. And we were part of this PIP plans. PIP plans is about, the states bringing the proposals to the central, to the NHM at near Manbhaun or Delhi. So I see all the proposals. It has been our proposals related to our program. It has been coming, and it has been accepting. So I feel that obviously the resource crunch is there, but the priority has been looking and starting looking for developing of this climate resilient these activities. So I mean the financing matter part, I mean it is coming, which was never seen before. So I don't think that this will be a big problem in the coming years. Thank you. Thank you very much.
Thank you very much. So you are showing a ray of hope that in future, because this is a priority, hopefully we would not face so much of resource crunch in terms of investments. That's really good to know. I'll now request, I'll come to each of the speaker one by one for closing remarks. And as a part of closing remarks, you could make any one policy recommendation or a recommendation for a resilient health system. Um, or you could focus on what could be the role for civil societies, because we have a lot of participants from civil societies tuned in today for this session. So um, I would start with Professor Gupta. If I can come to you for one recommendation that you think is like the real topmost one that comes to your mind.
Yeah, Ilya, you asked me for one recommendation. I'll use the same to give 2 points.
Great. Go
So,
ahead.
very first thing that health has to be mainstreamed into development. So all the sectors of development have to relook that whether their activities are how their activities are going to affect the health of the people, whether they are contributing towards the betterment of health or whether those are going on the other side, so they can address the negative, they can make adjustment so that the negative impacts are minimized and the positive impacts on the health are maximized. So this is one. Second thing is, health has to be made as everybody's business. Health should not be only that the government provides all free health facilities. Yes, certainly it is required because major chunk of our population cannot afford costly treatment facilities. And for that, preventive health and also health, making health as everybody business, at least especially at local level. So these are two things as my final uh, points of submission. Ilya.
Thank you very much. Very brief, crisp, and to the point. Really appreciate. I would now request Dr. Satpathy to make one or two recommendations. Again, I would request to keep it brief because we will be then moving to question and answer open round for participants.
Thank you, madam. As I mentioned in both of my intervention, I again highlight health is wealth. Any policy relevant to generate wealth need to consider health. Of course, when we are talking of the management of biogeosphere, there we have to see the human health, which is more important to manage the whole biosphere and geosphere. That's why we have to at national level also, all our policy, as we insist in one of the meeting in planning commission, the then planning commission, that all streams now should consider climate change aspect as they are doing in case of disaster management. Similarly, health is most important because it generates wealth. Second comment, here when we are talking of any approach, that community-based approach need to be introduced or need to be considered in the health governance. Thank you.
Thank you very much. Very important points. I would now request Dr. Rameshwar to please give his key recommendation.
Based on the, this involvement of these community-based organizations, I would like to say that developing a climate resilient health sector without this community-based organization would be impossible. And they are very much an important stakeholders to be a part of all together. It is not about the government only. It is the people's movement. No? It is the communities developing ways of this resilience that is very important. When people's movements and community movements are coming into the picture of this resilience, obviously our community and this the climate resilient health sector will be a success. Thank you very much.
Thank you very much. And now moving to Ms. Renuka, your key recommendation.
So, as I've been saying, healthy nations and healthy people are resilient people. So, if we start investing and building structures where people do not have to access hospitals, where people are healthy enough, that is the way forward for us. And we have to move towards a green and just economy transition. And COVID has given us this eye opener, and we have realized that this is possible. So all our policies, we keep health at focus, we keep public interest at the center, and then design our systems again. Thank you.
Thank you very much. We will now start the questions and answers. I saw that in the chat box there the questions have already been responded to. So I'll be randomly unmuting the people who have raised hands for questions. The first person to ask question is Dr. Diwan Singh Rawat. Dr. Diwan Singh, I'm unmuting you. Please ask your question.
Good evening, everybody. I am Dr. D.S. Rawat. I belong to the upstream company of oil sector from ONGC. I superannuated from there. And now I am associated with Paryavaran and Jal Selection of Uttarakhand. It is not the government post, but it is somebody associated. And I am Prant Pramukh of, Prachar and social media. I have got, I have been listening since 90 minutes, but I could not, I am just particular about the community participation as far as the resilience of the community is concerned. So all the speaker, I really regard all of you. I know Dr. Gupta and Satpati Saab also, I have met several times, though they may not be able to recognize me. But I have seen, nowhere the telemedicine has been discussed. The telemedicine, if you talk about the community radio or for the disaster purpose, and today our telemedicine guideline has been introduced. I have worked a lot in the telemedicine in my organization, and though I know very well about the telemedicine, but it has not been discussed since 90 minutes.
Yeah.
So I am a bit concerned about this thing. As far as as far as
Dr. Rawat, if you could keep your question short, and we'll get to the panelists then. One question is regarding the telemedicine, and I'll ask them. Is there any other question you have to ask?
Yeah, I'm just one thing is that, as far as resilience is concerned, NHM, some other speaker was talking about the resilience is concerned. And, if you talk about this COVID-19, the workers, ASHA worker is concerned, they should be given in the ultimate, warrior type of the, honor to these healthcare workers, They were not, they were not related with, healthcare people. But this time they have done, very marvelous job for the society, and still they are doing. Though a lot of questions are in my mind.
Very true, very true. I think
now with the,
no one will disagree. You are very right that ASHA workers need to be recognized.
As far as Paryavaran is concerned, Jalasana, I've got so many things because I was entire Uttarakhand today.
Right.
So we are just planning for Harit Ghar and Paryavaran Prahari and all, and we will come with a beautiful data, and hope I will associate with Unisphere in Delhi or Noida, because I am a resident of Sector 45 in Noida.
Sure, we look forward to do that, but because we'll have more questions. So any of the panelists would like to speak to his point on telemedicine and how it's important? We've not talked about it. Any quick comment from any of the panelists?
NCDC would like to make a comment on this.
It's okay. I mean, telemedicine, obviously, it has, an important role. This, what to say, there are many programs now in which the people have to move and participate in terms of times, in terms of money, this. So in this case, this telemedicine from telemedicine, this will take, an important role in, this reducing that aspects of this time also, or money also, and that will, contribute to the even green sector also, green part also. Thank you.
Thank you very much. We have one more raised hand, Basundara Ganguly. I will be unmuting you. Please ask your question.
Good evening, everybody. My question is, what role do you think psychologists can play in this endeavor, of making a climate resilient health system?
Okay.
Any of the panelists would like to respond to this?
Okay, this psychologist has a very great role in a climate resilient health world. You know why? Because the climate change, and one of the this important health impact of this climate change, as we discussed, is the direct health impact. Now, this is due to the extreme weather events. Extreme weather events means that it will cause these disasters and all, right? So, in this, as you see, in these disaster times or extreme weather events time, this will be increasing in this size in, this impacts. So many people will be impacted. So they will be, mentally, psychologically impacted. So psychologists will play a great role in the coming years, and they will be obviously taking that role.
Thank you. Any other panelists want to touch upon that?
Yes,
Yeah,
I have something.
Yeah,
And
Professor Gupta.
yeah. Dr. Satpathy is saying something.
Yeah, I will also have
Okay.
something.
Yeah, please go ahead.
Dr. Gupta can go ahead first.
Yeah, I would add here that the climate change is also known accelerator of environmental migration, that we also sometimes use term like climate refugees and the environmental refugees, and these people are actually the people under severe stress. So that is also important. For example, we refer it to the current scenario also, when the huge number of migrant laborers have gone back to their villages. So that is also represents a stress situation. So certainly in any kind of stress, and where the alternative opportunities can be provided, or consolation or counseling can be provided, so that people start thinking outside the boundaries, and people start thinking about the innovations or what else they can do at the local level. So uh, and they try to stand on their own with minimal external support. So psychologists have great role in counseling the people who are undergoing the stress. So that's very important. That's
We
all.
Okay.
also
Yeah.
we also said that as, psychological first aid. Whenever
Ye-
some,
yes,
impact
yes.
occurs, psychological first aid is required. So psychologists will play a big role in that psychological first aid.
Yeah, yeah. And you said psychological first aid, but psychological counseling or psychological support requires at later stage also.
Yes,
In
yes,
case of
as you told.
disasters,
Yes, yes.
when people, for example, someone has lost some important thing, or maybe a member of family, or some kind of major impairment is there. So certainly the psychological support is very, very important for all, even for the responders also, for disaster responders, and also we have seen in COVID, even the health responders, health workers also need psychological support.
Right.
Yeah.
Thank you very
Thank you.
much. I would now take
Yeah.
this opportunity to thank everyone, especially the esteemed panelists, Professor Gupta, Professor Dr. Satpathy, Ms. Renuka, Dr. Rameshwar. It was amazing listening to all of you, and personally, I learned a lot. I'm sure all the rest of the participants would have enjoyed this session equally. I would also like to thank Glenda, who's been doing the sign language interpretation. So thank you very much, Glenda. On also on the coordination and backend support, there are Valerie and Vaibhav. Thank you very much. And with this, I will hand over to Valerie for any logistic announcements. Thank you.
Thanks, Ilya. Surprise, it's me, Asta, instead. Valerie had to go off because of power cut in her area. Let me just quickly wrap up with a thanks to all the panelists and all the participants. And let me just share my screen so I can make a quick administrative announcement about tomorrow's session. I hope everyone can see my screen now. So to all the participants, please know that you will receive a certificate of participation for attending today's panel discussion. Please visit our website link, which is www.sphereindiacovid19academy.org after 24 hours, which will give us some time to upload your details to the website, so that when you click on that and go to the name of this panel and click certificate, you will be able to download it without any issues. Please know that tomorrow we continue with this week-long celebration of the World Environment Day with our second session this week. It's also at 4 p.m. and it's on climate change, putting public health first. You see a link before you, which is the registration link. We will also be emailing the link to you. And that's the extent of the panel that we have tomorrow. So you can see it's a very esteemed panel again. Lastly, if there's any issues, any feedback, suggestions, or questions for us, please do mail us at covid19academy@sphereindia.org.in, and we'll try and get back to you as soon as we can. This is it from me. And thank you to everyone and Glenda and Ilya for this amazing session. And now I'll go ahead and end the meeting. Thank you all for coming. Goodbye.
Goodbye, everyone.
Bye.
Goodbye.